This is Radio Health Journal. I'm Nancy Benson. This week, how childhood allergies and asthma often start with dry, cracked skin.
When your skin is defective, then foods that are in the environment can come through the skin.
Kids' allergies that get worse and worse when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Can I keep my dad's skull after he dies? Can I give Grandma a Viking funeral? What happens to an astronaut body if they die in space?
The curiosity around death that one woman hopes to answer. Then,
it takes 5 gallons of water to pre-wash a pair of jeans so they're soft when we buy them in the traditional method.
What's really behind the cost of those cheap jeans from H&M? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Allergy season isn't over yet, and unfortunately, allergies have no cure. A lot of people develop allergies and asthma in grade school, but researchers are finding that they can often be traced back a few years to dry skin and food allergies in infancy.
Food allergy and atopic dermatitis can occur during the first year of life. The combination causes the entire body to be very highly sensitive to the environment.
That's Dr. Donald Leung, head of the Pediatric Allergy Division at National Jewish Health in Denver, the nation's leading respiratory hospital.
As children breathe in things that they're allergic to, or they get viral infections that may affect the barrier of the lungs and the nose, then these babies go on to have what's called the atopic march, which starts with eczema or atopic dermatitis, marches on in the next step to food allergy, followed by the next step, asthma or allergic rhinitis. That can evolve over the course of 3 to 6 years.
It all starts with eczema, the result of a lack of proteins in the skin that normally would retain water. Leung says it's a disorder that affects more than 15% of infants, and about a third of them will go on to develop food allergies. It's a cycle of events piling on top of each other.
I like to tell my patients their skin is like a potato chip. If you bend a potato chip, the potato chip will crack, and then it creates fissures as well as openings in the skin, which allows infection or allergens from the environment to invade in, and then that causes the body to react to it. Foods that are in the environment can come through the skin, and the skin was not meant for eating. If other family members, as an example, are eating peanuts around the baby, then the peanut can come through the skin. And when any protein or allergens in the environment come through the skin tends to make an allergic response. And that can cause the entire body to erupt whenever the person comes in contact with that food.
A fraction of those children will then go on to other allergies and asthma.
We know based on animal models, not necessarily in humans, that when you apply the food to the skin of a mouse, that they can get asthma or food allergy. We also know that when patients have a defective skin barrier, and these are the humans, that they can also get a food allergy and more asthma. So we know the atopic march can occur because of a defective skin barrier. The skin's too dry, and you're getting cracking, and then allergen invasion. Or irritants in the environment can do this. Exposure to foods on the skin can do this. And we know infection can do this. So if your barrier is defective, then there's more tendency for infection to occur.
Leung is doing research on whether the atopic march can be stopped in its tracks at the very first stage by halting eczema in infancy.
If you think of a potato chip, if it's very dry, it cracks when you bend it. But if you had a wet potato chip, even though it wouldn't taste very good, if you bend it, it's not going to crack. And so what we teach our patients is to do a therapy called soak and seal, because we want to drive moisture into the skin. Now, because their skin is missing proteins that are needed to trap moisture and the skin becomes very dry, if they don't be mindful of ensuring their skin is well moisturized, then they will develop eczema as a result of invasion from environmental factors that may be damaging the skin. What we don't know yet is if we intervene and improve the skin barrier, whether that would block the atopic march. That's research that needs to be done. But it's important research because there is no cure for asthma.
Soak and seal is what doctors prescribe to moisturize the skin. It's not difficult, but it sounds like it can be messy.
You're exposing the skin to water. And this is classically for a young child taking a bath. And then it takes water roughly 3 to 10 minutes to penetrate through the skin. As I told you, these people have very dry skin. So the water goes through the skin, and then you want to trap it. Now, you know, of course, from high school science projects that water and oil do not mix. So what you want to do is put something oily on the surface of the skin to prevent the water from evaporating from the skin. So that is what's meant by sealing the skin. And doing the soak and seal then allows patients' skin to be better moisturized, less likely that they're going to get cracked and allow irritants or allergens to penetrate.
Leung says even how a baby is born can affect whether they'll develop allergies or not. It may help to explain why more children have allergies today than when C-section births were less common.
We now know that vaginal deliveries, for example, at birth, are much more beneficial than having C-sections, which take a baby right from a sterile environment without any exposure to the mother's bacterial flora. And the mother is protected not only with breast milk, but also through her bacteria, either going through the birth canal or just skin-to-skin association.
So it's clear that allergies are complicated and may start years before they actually show up. You can find out more about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
This week marks the start of the Medicare annual enrollment period, a time for Medicare-eligible people to choose the plan that best supports their total health. While physical well-being is often top of mind, CVS Health's Path to Better Health study found that 1 in 4 of those 65 and over report feeling socially isolated. Here's Christopher Chano, head of Aetna Medicare, a CVS Health company.
Feeling isolated from friends and family can take a toll on your mental and physical health. Many Medicare Advantage plans include extra benefits to help you stay connected, such as fitness memberships, transportation, meal delivery, and in-home support services.
The Medicare annual enrollment period runs through December 7th. Learn more at aetnamedicare.com/listen. That's aetnamedicare.com/listen. Aetna Medicare is an HMO PPO plan with a Medicare contract. Enrollment in our plans depends on contract renewal.
If you receive a cancer diagnosis, there will be many things to learn and manage. One is understanding that cancer and some cancer treatments can increase the risk for blood clots, especially in the first few months after diagnosis. Dr. Alok Khurana, professor of medicine, Cleveland Clinic Lerner College of Medicine, says it's important to create a plan to protect your health.
Make sure your cancer doctor knows if you have a family history of blood clots and that you recognize the signs and symptoms of blood clots. Signs of a blood clot in the leg or arm include pain and swelling with skin that's warm to the touch, red, or discolored. Signs of a blood clot in your lung are difficulty breathing, chest pain that worsens with a deep breath, coughing up blood, and a faster than normal or irregular heartbeat.
1 in 5 blood clots are associated with cancer. Knowing your risk, signs, and symptoms will help to protect your health. Learn more from the CDC and the National Blood Clot Alliance at stoptheclot.org/spreadtheword.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of Mediatrax Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Radio Health Journal stories about health, science, and technology on Apple Podcasts, Google Play, Spotify, and RadioHealthJournal.net. Also, follow us on Instagram and Twitter at Radio Health Journal.
Coming up next week on Radio Health Journal.
The social perception is that they're not committed or perhaps not skilled enough in just one, and so they're compensating by having a second or third job.
The psychological highs and lows of the gig economy.
Then, caring for strangers. As one doctor puts it, it's good for the soul.
What love requires is the ability to believe that their experience of their life is as important as your own.
All that and more on Radio Health Journal.